So good morning, everyone. Thank you for joining us this morning. Life may not be the party we hoped for, but while we are here, we should dance. And more so in this challenging and unique environment. We hope you and your loved ones are staying well. I'm Shubham Sharma, and I head marketing and PR for Forbase Care. Forbase Care is a Singapore-based precision oncology company engaged in the development of precision oncology solutions using advanced genomics and next-gen digital health technology to personalize patient care in oncology. So today I would like to welcome everyone on this lovely Saturday morning because today is a special day. Don't worry, it's not my birthday. But this very moment, we are officially launching a patient support program series. So what is patient support program series? So it's an effort by Forbase Care for all cancer patients and caregivers to help them enhance their quality of life. So on our first webinar, what better way to start than talking on the challenges which most of the cancer patients face, such as muscle weakness, physical dysfunctions, flexibility issues, joint stiffness due to chemotherapy, radiation, or surgery. So over the next 1 hour, we will be discussing how physical therapy can improve all functional problems. That's it. So let's kick off our first session by welcoming Dr. Archita Tiwari. Dr. Archita, she is the founder and director of Rehabics Physiotherapy and Rehabilitation Center in Bangalore. Dr. Archita is a member of Indian Association of Physiotherapy and she earned a Bachelor's of Physiotherapy from the Oxford College of Physiotherapy, Bangalore. She specializes in sports injuries, musculoskeletal injuries, women's health, and she has been supporting a lot of cancer patients to live a pain-free life. And I have been a direct beneficiary of her treatments and can confidently say she is very humble towards the patients and she will always challenge you to be the best version of yourself with an aim to live a pain-free life. So with much ado, let's welcome Dr. Archita. So Dr. Archita, floor is yours. And regarding questions, I would request everyone to post your questions on Q&A or chat window during the session, which I will take at the end of the session.
Okay. Thank you, Shubham. We'll start the slide share.
Yes, please.
Is it visible?
Yes, it is.
Okay. Fine. Good morning, everyone. I hope you all are doing good. And today I'm very excited to present this topic in front of you all. And I would thank Shubham and Forbase Care for giving me this opportunity to present this topic in front of you all. It's very important to present. You should know about this because, I often get patients who tell me that, it would have been very helpful for them if they must be, they would have known about it before earlier, but if their doctor would have recommended it. So that's why we are here. We are going to talk about benefit of physiotherapy in cancer patients. So yes. So as he has given my introduction, I'm founder and director of Rehabics Physiotherapy, which is situated in Bangalore, Mangla. So I wanted to ask you everyone, like, what do you understand by physiotherapy? So physiotherapy, it's a therapeutic technique where we use more of hands-on technique, and we basically work on two things. One is how your functional ability, how much is your functional ability, and second one is to improve your quality of life. So we were talking about physical therapy. By now you must be knowing what we do exactly. So according to WHO, recently they say that every move counts. What does it mean? Okay, it means we have to keep on moving. It's not only for the normal people, but it's also for the people who are going under some treatment, maybe the cancer, who are suffering from the cancer, or who are the survivors. Because of this lockdown situation, we are bound to sit at home. We are not actually moving a lot. So it's very important for everyone to keep on moving. It can be in any form. You can either do your household works, or you can just take your dog for a walk. Like, we have to keep on moving. So WHO says that we have to keep on moving, and every movement is important for us. So it really doesn't matter what diagnosis you have, as far as you have a pain, or if you have limitations, restrictions, obviously the physiotherapy will be always it will benefit you. Okay, so this slide says that what are the risk of the cancer in Indian population. Generally, what most commonly we see is oral cancer. We know a lot of people eat tobaccos, they smoke. So oral cancer is very common. We have ovarian cancer, we have prostate cancer, and tumors, osteosarcoma, melanoma. These all are the few most common cancers that we see in the Indian population. So we all know that what are the treatments our patients goes under for the cancer. So we have surgery, we have chemotherapy, radiation therapy, bone marrow transplant, immunotherapy, hormone therapy, and a lot of research are still going on. So we know that be it a patient who is going under the treatment, or the patient who went under the treatment, or the loved ones who's or the people whose loved ones are going under treatment, they go through a lot. So their body goes through a lot. They deal with a lot of pain, fatigue, anxiety. So these are the side effects where your physiotherapist can help you. We have fatigue, generalized weakness, neuropathy, scar tissue adhesions, joint restrictions, muscle tightness, lymphedema, osteoporosis, cardiovascular endurance, incontinence. So we will be discussing about it in brief here. I won't take much of your time. I will just tell you that what and all how physiotherapy can help you in all the situation. We can address that. So it's not like you have a tightness, you have pain, and you don't know what to do. So you can always reach to your physiotherapist, and they will tell you the best way that you can reduce the symptoms. So these are the physiotherapy management we often do in our clinic, and we teach their attenders also, so that they can make them do passively if they can't do actively. So these are the management. We have stretches, range of motion exercises, scar tissue mobilization, joint mobilization, Gait training, balance training, cardiovascular rehab, strengthening, lymphedema education and treatment, skin care, pelvic floor rehab. Skin care is very important again, because you will see that we try to teach each of our patient to do the skin care, because so that it doesn't go for infection. And we know that the most common infection we see in the cancer patient is cellulitis. So skin care is very important. Again, why stretches are, I'm going to talk about stretches here. Why stretches are important? Because whenever we go for more of we go for chemotherapy, we go for radiations. So it's always very you sit for a long hours, and your back, your body gets tired, fatigue, it start hurting. So if while you're doing the treatment or in between the treatment, you have to keep on doing the stretches and range of motion exercises. It will help you to reduce your pain, and it will help you to pull you through the treatment. So it's very important to do the stretches and the range of motion exercises. I will be showing you some pictures. Okay, if you have any doubt, so you can just ask me in the specific to any condition, like you might be having the specific pain, you can ask me at the end. So we have divided the stretches according to the body parts. So we have neck, chest and shoulders, back, hips, legs. Okay, it's also advised to hold each and every stretches for 10 to 20 seconds for 3 to 5 repetitions. Okay, and you always have to try to do this movements 3 to 4 times a day. It will be very good. So always try to hold the stretches, which is the key here. So if you can see the picture here, we have neck stretch here, okay, shoulder stretch, we have chest stretch, hip stretch, okay, we have this child pose which stretches your all back and shoulder, we have leg stretch. So I will be just telling you few stretches here. We can start with the neck stretch. What really you have to do is, it's nothing, just you have to extend your hand, keep on your other side of the head and try to stretch it without elevating your shoulder. Okay, so you try to stretch it, you should feel the stretch here. Okay, it's important for everyone, whoever is sitting for long hours while taking their chemos or radiations, or they're just lying down, inactivities there, they can do the stretches. Okay, similarly they have to do it for the other side. They have to make sure they're holding for 10 to 20 seconds, which is very important. Then only that stretch will be useful for you guys. Now, second, you can see she's doing the deltoid stretch. If someone is having um, they have gone through lung cancer, and or they have gone through mastectomy, breast cancer, breast removal surgeries, so they can always stretch their arms, because obviously it will be painful. You will be immobilized for so many days, so it will be stiff. So you try to stretch your arms. You just have to hold your hands like this and stretch it. Okay, you will feel the stretch on your deltoid and on your arms. So very important again. Then we have the chest stretch. You can see that girl has, you just find a corner of your house. Okay, keep your hands in the 90-90 angle and push your chest towards the wall, so you have to go inside, so you will feel the chest expansion. So again, which is very important in the different, everyone should do it, but importantly, the people who have the lung cancers or the mastectomy, breast cancers, everyone, they should do it. Then you can see the hip stretches. Okay, so it's not like that you have to do the same way. You have to do according to your capability. Okay, so whoever can do how much, you have to. If someone is fine, they are able to move, they can do the stretches nicely, they can go for this. Otherwise, their family members, their attenders can always help them to stretch their limbs. Okay, very importantly, so stretching is a key. You should always keep on stretching your body. So now we have is range of motion exercises. Again, we have cervical. Cervical means head region. You have shoulders, chest, back, legs. So here you can see the picture of cervical region, neck region. So this girl is doing range of motion. We have for every joint. Okay, right? So we have to keep on moving. So when you see the cervical region, she's doing up and down. Okay, sides, then side flexions. Okay, this is for neck. So similarly, we have for shoulders. You must be knowing, we all do this often. We circulate our, in anti-clockwise, clockwise, we always do that. Then we have chest. Back is very important. Again, if you know, I don't have picture right now, but if you know the cobra pose, right? You lie down on your stomach and you just push your back up. Cobra, how does the cobra do, right? Extensions. So that is very important. Again, leg movements are very important. Okay, you have to keep doing the circulations of the legs. You have to move your ankles. You have to keep moving your knees. So range of motion exercises is important. Everyone can do it. The patient who is lying down on the bed also can do this very easily. Okay, so if any difficulty, we always have the attenders to help them. So now we have scar management. So we often know the people who go under surgery, right? You can see the picture here. They form this kind of scar. So why it is, why it is formed? It's nothing but it's just a collection of the connective tissue which is formed while wound gets healed, which is very good. But then if it is very stubborn, if it is very thick and it's painful, then it's a matter of concern. So we have to always see that, it's not paining and it's not so thick. And so why it is its management is very important, because it won't allow you to stretch your hands. Okay, so if someone has gone under surgery, if they get this kind of scar and it's painful, it's very thick, they should work for this. Okay, they should ask their physiotherapist how they're gonna work. They might help you with that, or they will teach you how you can do. I will tell you here some. Okay, so the adhesions is what creates the pain there. Okay, so how to reduce that adhesions? So we have the massage technique here. You can see We have, you can see in the picture as well, we have cross friction massage, we have skin rolling, we have soft tissue superficial massage, lymphatic massage. What it says, cross friction massage is nothing but, you have to, suppose this is a scar, okay, and we are going to hold that, okay, we are going to go little deeper to the tendon, and we have to move perpendicular to the scar. Okay, you can see in the picture, okay, first picture, we are going perpendicular, we are going circular. You can use any cream, any moisturizer, and you try to release it. Okay, that is cross friction massage. You have to go deep in this. Okay, you have to go little harder in this. Okay, now second, we have skin rolling. That is, you have to pick the skin. You can see the fourth picture here. Okay, you have to lift the wound, the scar which is formed. You have to lift it, and you have to try to roll it. Let the flow, let the blood flow come in there, and you try to, let the layers go on each other, up, move on each other. So that will help in releasing your scars. Then we have soft tissue and superficial massage. It is very when to start. I hope you guys got this. Yeah, so now we have when to start the massage therapy. Okay, obviously when the wounds are open, you won't start it. Okay, but always you can start around the wound. Okay, so 2 to 3 inches away from the wound, you can start the scar massage, scar tissue massage there. And then when you can start over that, when the wound is incision is completely closed. Okay, when wound is healing, that time you can start the massage over that. Okay, now we have other aids also to take care of your scar tissues. We have silicone sheets here. We have moisturizing cream, which is many times it's prescribed by the doctors, your surgeons. We have the taping techniques. Taping is done by physiotherapist. So we always do the tape on the scar area, so that you know it helps in reducing the marks there and the adhesions. Then we have compression garments. Okay, people make the compression garments according to their convenience, according to their requirements. So compression garments is available as a aids for scar healing. Okay, so what is neuropathy? So we all know that the patient who goes under the treatment, cancer treatment, they feel the nagging kind of pain, right? They feel numbness, shooting kind of pain, burning sensations. So most of my patients, they complain of this kind of pain, that they are feeling very numb, and the shooting kind of pain towards their leg from the back. So why does it happen? So it's a chemotherapy induced peripheral neuropathy. Okay, so whenever someone is going under chemotherapy, their nerves, it gets damaged. Okay, so sometimes it's reversible, you can always get back, but sometimes it's not. Okay, so in that they have the continuous, that nagging kind of pain that they complain of. So yes, in this also physiotherapy, your physiotherapist can help. So you see the management here. We have the medication, we have the nerve medications given by your doctors. We have electrical stimulation that physiotherapist will be giving you. We have physical therapy, electrotherapy. So physical therapy, you get all the exercise related to your nerve stretches and all. Electrotherapy is modality, you can see in the picture, we are doing IFT and ultrasound. So that will always help the muscles to stimulate, and that pain to subside. So okay, so now we have gait and balance training, so which is very important. Okay, why it is important is because to reduce the fall of risk. So whoever goes under the treatment, they their bone density reduces, so which tends to osteoporotic bone occurs, and if they fall in case, they are more prone to get the fracture because their bone density is very weak. So that's why gait training and balance training is very important. And to avoid the fall in the patients, even if they are falling, their bone should not break. So we have to avoid the fractures by giving this gait and balance training to increase your strength, stability, and body awareness. So we have to do this. It's also one of the main important training that has to be. So as you can see in the picture, it's very simple. We are just holding, we are asking patient to hold something and lift the leg up. Okay, once they are able to achieve that, they can do without support. So, and then there are so many variations in that. You can put your one hands up, one legs up. Okay, you can do your your heel raises, then your toe raises. Then you can walk. We can give them the walking programs. As you can see in the picture, the women, she's walking closely. Footsteps. Her footsteps are close. So we can always give them variations in the and give them challenges to do it. And we always have to progress in this. Okay, we can't just stay with one training that you just hold something and then lift your leg. We always have to be progressive, then only they will learn to balance themselves. They won't be falling so often. So we have to do this. You in YouTube, you will get various of gait training exercises, balancing exercises, and I'm always available. You can reach out to me. So yeah. Then we have pulmonary rehabilitation. So the picture you can see here is a spirometer. Okay, whoever has whoever uh, has been hospitalized in the hospitals, they must be getting this. You must be aware about this. So this is spirometer, which is available in all the pharma stores and online as well. So pulmonary rehabilitation, why it is important? Because we after any surgery and all, our lungs, so that our lungs can lungs capacity can be better. So we have to keep on doing this. Okay, so you have to blow it out and you have to take that ball up. So you have to, that shows that how much capacity your lung is having. So anyone who is having shortness in breath, okay, who is very not so tolerant to exercises, who's who have stress, anxiety, and then long course of hospitalization, they must do this. So this will help you increasing your lung capacity, breathe properly, so reduces your stress. So pulmonary rehabilitation is very important for everyone, and especially the people who are not able to do any exercises. They are not going to increase their heart rate by walking and all. They are bedridden. They must do this spirometers. Okay, it's available in the market. And yeah. Now, what is the recommendations of exercises? Okay, we all should, okay, including the patients and everyone, we all should do at least 30 minutes of exercises, right? And how we should divide it is, 5 days per week, we have to do some aerobic, low intensity, moderate intensity aerobic exercises. Aerobic means it can be in the form of cycling, it can be in the form of walking. So whatever you like, it's per your interest. It's not like you have to do this only, whatever you like, but it should be at least 30 minutes of exercises. Okay, then you also have to do some strength training. Okay, so strength training is important for your stability. Okay, to the muscle, to maintain the muscle health, no, only the exercises will help. If you say, give me some food, and I want to increase my body strength, my muscle strength, it's not possible. Only exercise is the one thing which will help you in increasing your muscle strength, nothing else. Okay, so you have to keep on doing strength training. See, as you can see, we are using dumbbells here, we have therabands here. Okay, so you can always do some resistance exercise. Okay, it can be against wall also. If you have a wall in front, you just push a wall. Okay, so wall will also work as your resistance. Okay, so here you can see we have a theraband. Okay, we have a free weights means this dumbbell the girl is doing. Okay, or we have different, if someone is able to go to gym and access to the gyms and all, and some people will be having the machines at home, they can always try those machines and do according to their capabilities. Okay, we have body weight resisted trainings, that is push-ups, pull-ups, all those you can do, whatever is in your hands, but we have to do strength training at least twice a day. okay, which is very important. So total of 150 minutes in a week we must do exercise. Okay, 150 minutes in a week is not a big thing, but you have to keep on moving. So that's a whole agenda. Okay. Now, lymphedema, it's one of very important and most common thing, and you will see in the patient with after surgery or after hospitalization, after chemo. So you can see here in the picture, the one of the leg is swollen, right? So it's nothing but it's an accumulation of the protein rich fluid, okay, which causes inflammation. So you must be seeing, some people will have pitting edema. You will press, it will go inside, it will come back. Some people will have non-pitting edema, it won't go inside. So different kind of lymphedema we see in the patients. You can see here stages as it is seen in the picture. The first one is abnormal flow, but there is not much swelling, right? So there is no signs and symptoms, so you won't really come to know that patient is having lymphedema. Second one, you can see mild swelling is there on the left side, left leg. Okay, so if when you press it, it will leave the dent, it will leave the mark, okay, the pressing mark. The third one we have is a permanent swelling, okay, that is third stage. So even if you press, it will come back. That means it's more, the edema is more, the swelling is more. Okay, and the last stage you will see is the elephantitis. Okay, here it's irreversible, okay, it will always stay there. You will see a lot of extra growth of the muscles there. Okay, we say it what like growth will be there, and it will be very it will be painful also, of course. When your limbs are big, it will be painful. So you will see all this kind of the stages there. Okay, now we have lymphedema management. Okay, so we do lymphatic massages. Okay, I told you, we do a light massages throughout the swelling, and so that the fluid gets drained out. Okay, it gets it flows in the vessels, and it doesn't come out in the body and don't show the big swollen limbs. So then we physio do this. Then we have a compression bandage. You can see in the picture, the doctor is wrapping up the compression bandage, right? We have compression garments also. So compression garments you can always modify according to your your demand. What is your demand? Some people don't like their ankle to be toes to be covered, so you can always modify according to your convenience. It's available in the market. Compression garments, you have to always wear. If someone is having big limbs or swollen limbs, grade 3, grade 4, they have to keep on wearing that compression garments. So 24/7, they don't have to remove it. So of course we have to, which is very important. Exercises, there are specific exercises in regard to lymphedema. We say Boger exercises. You have to keep your lymph elevated. So we have specific exercises for lymphedema. Then skin and nail care is very important, because it's a most common thing. Because of the swelling limbs and all, it starts hurting, the texture changes. So we have to keep it always clean cut, and always put a moisturizer there. Always do some finger exercises, very important, skin and nail care, so that it doesn't go under some infection. Then education and precautions. So I told you, right, you have to always wear it 24/7. You have to keep your limbs elevated. So by this all, you can avoid the lymphedema to go to that extent. Then we have pumps, as you can see in the picture. Okay, it's a compression pumps. So you can take the compression according to your how much ever you can tolerate. So that will be helpful. So we have garments, compression garments. It is given by your doctors according to your prophylaxis and management. And whatever compression is required, that much only. Every individual needs different compression, so it depends on that. And it should be professionally advised. If your doctor is not advising, if your physio is not advising, you don't have to wear it by yourself because you have swelling. So it need to be professionally advised. Okay. Now, okay, we are coming to the last 2 slides. So how to start, how you can start to be physically active. This is all the conclusion. You have to start it slow. Okay, it can't be like one day you're going and doing everything. You're doing your walking, you're doing your strength training. It's not possible. You have to start slowly. One day if you're doing 10 minutes, another week you start with 20-30 minutes. Okay, so start slowly. Try short periods of exercise. Okay, so if you're morning you're going for walk, evening you try to do your strengthening. Okay, if you have a strength. So try to divide it, short periods of exercises, you divide it in five minutes. So that will be helpful. Use large muscles. What do you mean by that? So large muscles means if we are doing bridging, okay, if we are going for run, so you that works on all your muscles, right? So use large muscles for training. Okay, then we have include strength training and flexibility exercise, right? Strength training, I already told you that you can go with the dumbbells and therabands. Flexibility means you have to, you can go do in the form of yoga, tai chi. If you like yoga, very good. It's very good for your flexibility. You can also go for swimming, right? So swimming is one of the best exercise. It will increase your strength. So also you have to start with a warm-up exercise. Very important. We just start exercise, right? We should always start warm-up exercise, and we should also end up with the cool down exercise. So warm-up exercise is a quick dynamic stretch, like we do jumping jacks. Okay, we can, whoever can't jump, they can just move their hands, so which will be very useful for them, very important for them. Now exercise as you are able. Okay, जितना भी आपका, जितनी भी आपकी हिम्मत है, जितना भी आप कर सकते हो, यू हैव टू ट्राई टू उतना ही करो. नो नीड टू जस्ट जंप इनटू द, एक वीडियो देखा अभी हमें वो सारा करना है, नहीं, ऐसा नहीं होता है. आपकी जितनी एबिलिटी है, आप जितना, आपकी कैपेसिटी है, आपका कार्डियोवास्कुलर जितना अलाउ करता है, आपके हार्ट रेट जितना अलाउ करता है, उतना ही करो. एंड स्लोली स्लोली यू progress. Okay, exercise in a safe environment, very important these days. We all are going through the pandemic, and we don't want our patients and our people to get suffer from COVID. So you have to make sure you're exercising in the safe environment, clean environment, where a lot of you know good environment is there, trees are there, not a lot of people are there. There you can you can always exercise. Stay hydrated, keep on drinking, sipping water throughout the days. We all know this, and but we don't do it. Okay, so we all should stay hydrated and eat nutritious food. Very important. Okay, that will only give you metabolism, that will help you in do your exercise strength. You will eat junk and you won't really find the strength out of it. You have to eat nutritious food, very important for everyone. Okay, see your doctor regularly. So don't take any advice, don't do anything by yourself. Always you should consult your doctors. Okay, your physiotherapist, your occupational therapist, whoever is your nurses. So whoever know about this, they will guide you in the proper way. So always see your doctor regularly. So we have 4-based care also. You can consult them whenever you want. So it will be helpful for you. Now how to stick, we told you about how to start being physically active, but we how to stick with it. So you try to set a goal, short term goal and long term goal. So short term goal may, if you are setting, okay, today I have to walk for 30 minutes. Okay, so your long term goal should be that after 1 month, in coming 1 month I should be able to run. So you always have to set a goal. So that will be very good for you to stick with the exercises. Then second we have is focus on having fun. Okay, whatever gives you happiness, whatever gives you excitement, always do that. Okay, if you feel like cooking is your thing, cook, no problem. If you think dancing gives you excitement, dance. Okay, so whatever, but yes, in your limitations, you should not push yourself too much. Just keep on doing something, just don't sit ideal. Third thing is do something different to keep it fresh. Try yoga, dancing, tai chi. I said, as I told you, whatever. Some people like swimming, go for swimming. So then group therapy, especially we see in the older generation, right? They are not motivated enough to do any exercises. So if we make a group, and we may, in our clinic we do that, so we make a group and we try to make them do together, so they get motivated always. So group therapy is always a good idea for everyone, even for old age, especially in old age people, because they're not motivated enough. But group therapy is good for everyone. It gives you energy, it gives you motivation. So group therapy, then use a chart to record your exercise progress. Okay, so again, I told you, right? Set your goal and try to tick it. Okay, I was able to do walking for 30 minutes today, I was able to do the exercise with the TheraBand today. So you should always chart it, so that if you see your progress, you will get more motivated. So very important to record your exercise progress. So yeah, here I end my session with you guys. I hope whatever question is there, please get it, and I hope you guys like the session. Thank you.
Thank you so much, Dr. Archita, for this informative session. And I'm sure everyone on this call will benefit from this in their day-to-day life. So with that, let's open up for question and answers. So the first question is that how to manage a neuropathy, especially allodynia cases by physiotherapy means.
Especially what, Daniel?
Allodynia cases by physiotherapy means.
Yes, is patient, we can always, neuropathy is pain which is radiating. They might be feeling the numbness. Okay, so they can always we have specific exercises for each joints. Okay, if someone is having nerve pain, okay, so we have the specific stretches for them. So we should always you have to meet your physiotherapy for, I can't tell you here right now how to stretch that. So you have to meet your physio, and they will tell you the specific stretches for your this condition. So yes.
Okay, thanks. And the next question is that how much pressure they need to be applied during the scar massages?
Yes, it should be according to your tolerance. Okay, yes, it should be a little deep, where you can feel the tightness. Okay, where you can feel the formation of the scar. You will feel the knot, adhesions. So you have to hold that. You have to try to do. It can be 50 to 60% of your overall pressure. So you can just go a little deep, press it, and move it. Perpendicular to the scar. So it can be 50 to 60% of your total pressure.
Okay. And what strategies do you suggest to manage fatigue in cancer patients by means of physiotherapy?
Constipations?
In cancer patients by means of physiotherapy.
Okay. Fatigue.
Yeah.
Fatigue, right? They have to do a lot of breathing exercise. Okay. Breathing exercise is a key. I told you to do the spirometry. They often get fatigue. So they have to, if they can't do themselves, their attender have to help them in stretching. Okay, and do the range of motion exercises that will give energy to the muscles. I told you, right? There is no ways to give energy to the muscles other than exercises. So fatigueness happens when you have a lack of uh, and lack of energy, and you are not moving enough. So your muscles are at one place all the day, so you have to move it to give the energy. So that will help you in reduce the fatigueness.
Okay.
So yeah, exercise is a key. Stretching, range of motion.
And one of our patient is asking that they, after fracture or swelling, they can remove the swelling because it's been 6 months. They have a swelling in the foot. So how they can remove?
Okay.
Yeah.
So it can be edema. They have to first know what sort of swelling it is. Is it a pitting one, or it is not? It is just going inside and staying there. Okay. If they are not, we have joint mobilization technique. Okay, we physio do it. So on the fracture side, we try to mobilize the joint. If there is no enough of joint mobilization, so there will be a swelling. Okay, so they have to make sure they're visiting a physiotherapist and they're mobilizing the joint. If they, I am sure he would have not mobilized the joint after the fracture, so that's why swelling is there. Okay, and they have to keep it in a compression bandage. So not 24/7, but whenever they are walking, whenever they are hanging their leg down. Now it depends where fracture is. Okay, if it is in leg, if they are putting it down, hanging it down, then it will swell up. So they have to do mobilization, they have to do exercises, they have to do strengthening, mobility exercises to reduce the swelling. So yes, fracture, very important is joint mobilization, okay, which is done by a physio. They will teach you to do how to do yourself. So I think he would have not done it for sure. Yeah.
Okay. And one of our patient, he had undergone kidney surgery, and now
Hmm.
he is with one single kidney. So he's asking if he can do the dumbbell exercises with 5 kg weight for biceps and shoulders.
Yes, if depends now how is his energy. If he's feeling good, there is no harm in doing dumbbell exercises. Why not? But then again, it should be it should be in progression. If first he should start with 2 kgs, if he is able to lift, then he should go for 3 kgs, then he should go for 5 kgs. It shouldn't be that, like, one day he can go for 5 kgs. Dumbbell exercise, he can sit, it's a kidney surgery, right? He can sit and he can go with the hand for biceps and triceps. He can always do. But again, we have to check that how much strength he's having. It shouldn't be like he's not having strength and he's putting all his efforts and he's pressurizing his abdomen to lift that. It shouldn't be like that. He have to see his capability, how much he can do. So yeah,
Okay. So
we
the
have
next
to do
question
the
is
testing.
that if we can do this massage therapy for all kind of surgical scars.
All kind of surgical scars, definitely. If you have if you after every surgery you will have a scar, okay, and if it is not opened, you can always go for a scar tissue massage. It's not in the, no one say your doctor, your surgeon will might not say you can do the massage, scar tissue, massage. Sometimes doctor says it, but not always. So it's done by physios, and we will teach you that how to do the massage to reduce that adhesions, tenderness. You can always do that, as far as your wound shouldn't be open. Okay, if it is open, you have to do around it, not on it, because obviously, because of obvious cause it will create infection.
Okay. Okay. And the next question is that one of our patient's brother, his legs and waist hurt a lot. So what should he do?
Legs and
Waist.
waist hurts a
Yeah.
lot.
Yeah.
Okay,
Yeah. Hurts a
he
lot.
went under what surgery have we mentioned?
No, he didn't mention about any cases.
Okay, so fine. So his leg,
Yeah. So his brother is rectum cancer.
rectum cancer, yeah,
Yeah.
right. So it's coming from his groin area. So we have to do the pelvic floor management, very important. Okay, we have to strengthen his pelvic floor area, and it's radiating from his pelvic area. So we have to make him do bridges exercises, leg movements. So yeah, a lot of exercises, and he can um, rectum, you said rectum cancer, right?
Yes. Yes. Yes.
So yes, I think you have to move it. Now you have to tell me whether it's a neuropathy kind. He feel the numbness kind of pain, or he feel just a normal pain. So we have to make we have to design the exercise according to his symptoms. So first I need to know exactly, and we have to assess him properly. Said
Okay.
what kind
So
of
maybe
treatment
I
he
can
can.
talk to the patient and I can get back to you offline.
Yes, yes.
Yeah.
So it
Okay.
will be better that he can talk to me directly, because I need to know. It's not only that he have pain. We need to know what kind of pain it is. Okay, then only we can give the
Okay.
treatment plan. So
Okay.
yeah.
Okay. Cool. So that's all. So we had so many questions. It seems like we have a lot of energy today in the room. And
Yeah.
so with that, I will wrap up the session. And I would request everyone, you can please reach out to us offline. And if there is any more queries or any more questions or anything we could be helpful with. So and from behalf of Phobase Care, I would thanks Dr. Archita for your time, and thanks
Thank
everyone on this call that you spared your time on Saturday morning to
you.
attend this session. Thanks everyone.
Yeah, Shubham, let them know that they can reach out to me, because I have not.
Yes, yes. So
So I
you
wanted
can reach
to
out to Dr. Archita. I will
address.
share her details with you over WhatsApp and over your emails.
Yeah.
Yeah.
Okay, guys.
Okay.
Yeah.
Thanks, everyone.
Thanks.
Have a
Thanks
good
for.
weekend. Thanks.
Yeah.